Um, I did email some last night, and then I found out that I changed my videos. They were private. I moved them to enabled or whatever that was, and then I tried to send it to people and it couldn't open it. But when I send the links individually, people can open them. So later, after I get done with my other 2 Zooms today, I will send you an email with the individual links to my channel from all the lectures we've done. The only one that didn't record, and I must have paused recording and then I must have not unpaused it, was when we talked about hip dysplasia. It was a 3-minute video and it was all me talking about attendance. Yeah, Caleb, I put them as unlisted, and when I sent the link to my channel, it shows no videos. But when I sent people the individual link to each video, it worked. Yeah, so Neemer had an issue, so she helped me last night. Neemer had to do the same thing. She said she just has to send them individually instead of one link to the whole channel. So yeah, so I'm going to do that later. So the stifles are recorded. I'll send the AP review video. The only one I don't have is hip dysplasia. I guess for some reason it didn't record. So if people have questions about that, I can always answer. But what I'll do right now, just get everybody muted. You can always type something, and then we only have a few more slides, and then I figured I would, that I would talk about the homework, and we can go through that if anybody has questions. I will be sending out later the link to the answers to the homework, but I can also go over some questions in person. Are you outside now? Who is that down there?
It's me. My dog wanted to go potty.
Your dog's like, get out of bed, go potty.
He jumped on me and started barking.
Yeah, he's like, come on, let's go now. Okay.
She's actually just chewing on a toy. She's not even going potty.
You're like, seriously right now? I had to force Bo to go out because he hates when it's like rainy or cold or wet grass. So he tried to just go pee and come in, and I was like, go poop. And luckily you point, and then he goes back, and I'm like, see, you had to go. I know this. Okay, so what I already had showed this picture, but just to explain the difference, when we have a fracture and when we talk about fixation or fixing it, 2 forms was the internal, which is when you have to open them up surgically and put on a plate or put a pin within the bone, not from the outside. An external fixator that's here is they will literally, a lot of times what we do during surgery is we hang the leg and the doctor places the pins from external, internal. So these are pins, but they're placed in just a different way. If we put a pin down the middle of the bone surgically, that is internal, but this is external fixation. Most of the time when we do external fixation is the angular limb deformity. So like if you got the short guy with the crooked legs, or if there's been a lot of contamination, if it was an open fracture, if it was like when I talked about that dog getting mauled at the training facility, because it was bite wounds and there was multiple open wounds, it would not be good to close that leg and trap all of that infection. So external fixation is done for this. So actually, Miranda, these pins go through the skin into the bone. So these are going from, if you look on this picture, they will usually go through the bone, but we go through the skin. When you go in surgically, you're placing the pin directly in the bone, but it's not going out through the skin. So that is the difference. And like I said, when I showed this picture yesterday, you can see that's open. And a lot of times, if it was a trauma, if it was an open fracture, there's a lot of infection, they want to leave it open to drain, like abscesses. Abscesses are usually left open to drain because if you close it, you trap that pus and it's going to fester. So usually when we do external fixation, if it's been, it's a good technique for an open fracture because we can flush those wounds. We can let that infection drain, and then eventually that's going to close. That is going to close up the wound. If we look now on this picture, this, you can see this is a complete, and this is here the elbow. So this is the radius and ulna. This is the humerus up here. So you've got the olecranon, is that back there. What they've done here is they have put a plate and screws. This is internal fixation. So this is done surgically and everything is internal. They have put they have put a pin through the olecranon down into the ulna. But most of the time, like I said yesterday, when you fixate the radius, which is the weight-bearing bone, a lot of times the ulna is going to heal. I think the reason they put the pin here is because there was quite a bit of displacement. If this fracture could not be reduced, like the doctor could not get those bones to line up just by manipulation, they may have added that pin after the fact. Now, I will say, sometimes these dogs will come in and have just the pin removed and they'll leave the plate and the screws. So I've done sometimes the surgery. I kind of like those surgery when I was at Purdue because I'm like, oh, that's a quick, easy surgery. You anesthetize them, you make an incision, doctor pulls out the pin, closes it, done. So sometimes pin removals will move and they sometimes have to be removed. The thing with a pin, it's smooth. So sometimes what's going to happen as that bone heals, sometimes the owner will say, oh, there's a little bump on my dog's leg, and you'll see, we can feel, and that pin has started to migrate and kind of poke into the skin. When that starts to happen, a lot of times the doctor wants to remove that pin because it's a source of pain. But in this case, if we pull the pin, we have fixation on the weight-bearing bone. So the pin in this dog is not going to do as much once this part heals. So in the next picture, so this is just showing, this is an example. This first one is like some K-wires. Do you see how this second one is thicker? That's the IM, or the intramedullary pin, and it goes through the medullary cavity. So IM pins, I asked once on a test, because I used to teach Animal Tech 6, and I said, does an IM pin mean intramedullary or intramuscular pin? And I had some people put intramuscular pin, and I said, hey, come here, I'm gonna put a pin in your muscle. And they were like, oh, okay, I get it now. I'm like, no, it goes in the middle or the medullary cavity. And again, it's gonna depend on where the fracture is, how many pieces, what's the force on the bone, and that's up to the surgeon if they're gonna use a pin, wires, plates. You can see here, that plate goes, and the plate has to bridge both sides of the fracture. For those of you, I brought up Duke yesterday. When Duke had his fracture, it was a distal radial fracture. So it was the distal radius. The problem was the fracture was so low that it was near the carpus. And what happened was when he put weight, it was because that plate was so close to the bend, and the weight, I mean, that dog would jump, 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 and he's putting a lot of force on that distal radius, and it caused a bend and a crack. But normally, the doctor tried to bridge the fracture, but the fracture was so low, he couldn't get enough fixation on the distal part, if that makes sense. And, you know, always whenever we get back, it would be interesting if anybody ever wants to see his radiographs and I could explain why it was such a distal fracture and why it was such a problem in that dog. And let me mention something controversial, well, not controversial, but in a dog like Duke, or if we have a really bad fracture and money is an issue, we have done amputations. Because the problem is Bo, oh God, please, now Bo not gonna break his leg this weekend, but Duke, he could have potentially had an amputation. The shelter decided, and the school decided they wanted to pursue fixation. I mean, that's obviously going to be better. With a German Shepherd, you have problems later potentially with the other leg holding all the weight. But we have had people come in where the bone was so fractured, money was potentially an issue, and we have amputated legs because maybe fixation or repair was not an issue. So it's not really part of this lecture, but I just mentioned that because that is a potential option for fixation. Here's using just cerclage wire. So this is an oblique fracture. And it's non-displaced, but they've taken that wire and it's almost like a twist tie, like on your bread bag. It's like if you take two pieces, you put that wire, and then they'll take wire twisters, they clamp it and they twist it, and then they'll cut that wire really close to the bone. But that is a form of fixation. And here, so this is, you know, they got the hips here, we've got the femur, this is distal, and we've got a fracture here, and we've got a distal tibia fracture. Now, this is fractured near the distal epiphysis, this is fractured near the diaphysis. So the ones that are broken right in the middle are a little bit easier to fix. Anytime you have a fracture close to a joint, like up here, it's a little bit harder to fix because that's where the leg bends naturally. So those are always a little bit, I would say, more tenuous for repair. They can be fixed, not always successful. So you can see what they've done is two different types. They've put IM pins through this fracture, and then they've put a plate on this fracture. So again, you can do different methods, but a lot of that's based on the weight of the dog, where the fracture is, what type of fracture. And again, if you've got a super active dog versus a couch potato, sometimes that's going to determine the type of surgery that you're going to do. If we look on here, there is a website that talks about the classification, the diagnosis of these fractures. Most of this, again, came from, you know, there's all of this is in your common diseases book. Also that ACVS, I'll say that for any surgery type of issue, especially these orthopedic issues, is that surgery website, acvs.org, is going to be a good resource for these potential issues. Okay, so if there's no questions from this, is there any, I know I've gotten a few emails, is there any main question from the homework that you wanted to discuss live, because it might help everybody to hear it if we talk about it together? I know some people had questions and I've tried to answer. Anybody can feel free to pop in or.
Number 15.
You didn't have any questions? One of the things on the homework, and I will be putting those points in later, the three main corrective surgeries for hip dysplasia. And it was really talking about total hip replacement, FHO, and TPO. But the difference that we talked about between the FHO is more salvage procedure. If you remember, it's got to be for the little guys. And it's more of a salvage. Yes, so I'm going to go over 15. I'll go over that in just a second. FHO, you're taking off the femoral head and it forms a false joint, but we can't do that in large breed dogs. It's going to then put too much weight on that leg. So that would be potentially a cat, because I did mention it's rare, but cats can get hip dysplasia. But the reason you're removing the femoral head is it's a source of pain. Every time that dog or cat walks, it's rubbing on the joint. So if you take off the head of the femur and then you just have the shaft of the bone is hanging out here, when they walk, it's not causing rubbing, and that's what's giving the animal pain. So it's not curative. We're not fixing the hip dysplasia. The only way to fix hip dysplasia is to either do that TPO, and that's when you change the angle of the acetabulum. You cut the pelvis in 3 spots, and you basically rotate. So you take the acetabulum that's maybe here, and you cut it, and you give coverage. And then this shouldn't slip out. You should get good coverage. The absolute best or gold standard procedure is a total hip replacement. It's like pretty much the same surgery that people would have. But again, that's much more expensive. It's risky from an infection standpoint. You have to use the strictest OR surgical aseptic technique. You get into that in your surgery class. But you have to be very, very, very careful when you do that. 15, which type of luxation is associated with trauma? So when we have hit by car, potentially dropping a dog, or a dog launching himself off the deck, any of those could be trauma situations. That would be a lateral tear, a lateral luxation. So if the knee moves laterally, that's more associated with the trauma. 14 was which type of luxation is for the toy breeds, and that's medial. The reason it's medial, well, it's hard for me to demonstrate this, but they're almost knock-kneed. So the little guys, because they've got these short legs, the patellas want to go in medially. But when a dog luxates its patella like a large breed, it typically wants to go laterally. And if we think about physics, they've got I brought home some bones because I'm doing anatomy, and I happen to have a femur. Okay, Bo has been trying to get in this bag and get these bones. It's been hilarious. I have a bag of a skull, I've got a scapula, and he was crying at the bag. And I was like, get out of there, this is not for you. So I thought that was kind of funny. But if we think about the length, obviously this is not, it could be a very big dog, but I think this is maybe a cow. You've got the groove, but it's not going to be prone to move medially, but that force may cause the patella to go laterally. And then again, if you have a shorter femur, that is going to want to luxate more medially. Okay, so that's the difference with the medial versus lateral. So hopefully that answered that question. And let me look at this for a second. For number, when I was surprised to see they were smooth. I thought they would be threaded. That's actually a good question, Caitlin, and you might talk about that a little bit in Animal Tech 6. There are what are called smooth IM pins and threaded IM pins. Now, depending on where you want to put the pin, some doctors, it's basically like threads on a screw, okay? Some of these pins have threads at the end and some are smooth. So we usually had a pin pack. We had a smooth IM pin pack and we had a threaded IM pin pack, and the doctor would ask for one or the other. So in vet med, well, Caitlin, if you're putting it in, think about this bone, we put it the right way. If we go in, there is kind of a groove. Okay, this is the head of the femur, and right here, there's like a divot. This part is actually fairly soft. It looks hard right now, but when they put it on a drill, the tip is good enough, and once it gets in the medullary cavity, that's soft. That's that spongy bone, and that's bone marrow. So usually a smooth pin will just slide right in. They do put it on a drill or a hand chuck where they kind of twist it and drive it in. Now, a threaded IM pin, if you want to go through the cortex and you want to go this way, then a threaded pin is going to have to kind of drill, if that makes sense. Then you would use like what's called a threaded pin, and that could actually work like a corkscrew and go through the cortex. So it kind of depends, but if you place it directly in the IM, or the medullary cavity, that pin will slide, right? It doesn't need threads. But I will tell you, a smooth pin does sometimes have the ability to start to migrate out because that thread is not necessarily there. And the more they move, sometimes it'll work the pin. That's why anytime a pin is put in, we always tell the owner, if you see any bumps, lameness, issues, let us know, because it could be that pin is migrating out. Someone messaged me number 13. 13, which is more common, a medial or a lateral patelloluxation? Medial patelloluxation, MPL. And I think 2 or 3 days ago, I misspoke when someone asked me, what does MPL stand for? MPL stands for medial patellar luxation. And because we commonly see this genetically in the small breeds, that's the reason you see mostly patellar luxations. And most of the time they're medial. And most of the time they're the little Yorkies, poodles, Pomeranians. And that's most often how we see it. And again, if we see a Labrador with a patelloluxation, more than likely the dog did something and it probably popped out laterally. So number 32, someone had a question about, what is the most common cause for lameness and pain in dogs? Yes, that answer was hip dysplasia. So most of the time when we see dogs that come in that all of a sudden maybe are lame or painful. Now, I will tell you, when a dog comes in holding up their leg and the owner says they're not going to put weight on it, sometimes they didn't see anything happen. Okay, sometimes all of a sudden their dog came in. A lot of us let our dog outside and they, have roam. Not everybody watches their dog outside. So we don't know if it was acute, but I would say the main thing that we deal with in practice is hip dysplasia. And sometimes the dog had it probably when they were young, and it just got hard, more severe as they age. The more you get that wear and tear in the joint, that's going to build up arthritis over time. Before I answer that next question, I did want to say something about number 10. I think it was number 10. Who are the candidates for TPO surgeries? The key there, if you remember, they cannot have arthritis. For a TPO, so these are typically done in the very severe hip dysplasias that we see in young, maybe, 5 to 12 months old, 6 months old, So a TPO is not an old dog surgery. That's a young dog surgery. Total hip replacements could definitely be, I would say most of the total hip replacements we did at Purdue, and we didn't do a ton, but we did enough. They were all, middle-aged to a little bit older dogs. So more of our total hip replacements and our FHOs were older patients because those fix or solve arthritis. TPO, we're trying to salvage them before they get to arthritis, if that makes sense. Someone asked a question about 20 and 23. So 20 is what would be the benefit of placing let me make sure that's right, of placing a dysplastic dog on Cosequin. It's basically the glucosamine. Cosequin is glucosamine and chondroitin. It contains two what we call nutraceuticals. So it's not a pharmaceutical because it's not a drug. It's a nutraceutical because they're using natural products. The glucosamine is what's going to help rebuild the cartilage, the articular cartilage. And the articular cartilage, if this is in the joint, this is the head of the femur, it is covered with a layer of articular cartilage. That glucosamine is going to help rebuild, because every time there's hip dysplasia, and this is rolling around in the joint, it's eroding all of this cartilage. So the glucosamine builds this. The chondroitin component of that is going to stop the cartilage from breaking down. So glucosamine builds it up, and the chondroitin is trying to slow down the degradation process. 23 said, how is PEN-HIP different from OFA? Now, PEN-HIP, I will tell you, now, one difference is the doctor has to be certified to perform a PEN-HIP x-ray. So your doctor, not everybody can do a PEN-HIP. And there's also a special bracket. Also for PEN-HIP, they have to be anesthetized. If I didn't stress that in the lecture, PEN-HIP, because they push against this bracket and then the bracket pushes their hips the other way, the only way to truly do that is if they're completely asleep and you have complete relaxation of the hip muscles. OFA, we can do them sedated. So sedation, they're going to still be somewhat with it. Also, their muscles might have a little more tone. And OFA can be done by any doctor at any clinic. They can send in the paper. You basically download the form from the website. You fill it out, you send in the x-rays, but it doesn't require special certification. It doesn't require the special bracket. So it's a little different from OFA and PEN-HIP. And again, also PEN-HIP, I should add, can be also done as early as 6 months old. If you remember, an OFA, they have to be 2 years old. And you have to prove it. You can't just say, oh, this dog is 2. Now, a good radiologist looking at x-rays can tell if you've sent in x-rays on a young dog versus an older dog. So they would probably be able to tell if someone was trying to falsify, but usually you have to send in some type of papers. And most of the time, OFAs are being done on breeding dogs. So typically they have papers on these dogs about, you know, when they were born and things like that. Someone asked about 25. 25, oh, this is where my sheets get different. On your paper, is that who is usually affected by PAN-osteitis? Okay, so PAN-osteitis, hang on, this cut off my paper. Why do I not have that question? Okay. PAN-osteitis is typically going to be medium to large breed dogs. I didn't get into this. There was a few things that I cut out of the lecture. There's a thing called legs, calves, Perthes disease that gets into PAN-osteitis. But because of large to medium breed dogs, it causes the way their bone grows, and it can cause a osteitis or an inflammation because it causes an abnormal movement of a joint. But PAN-osteitis isn't going to be on the test. So I will say that I should have probably took that question off, but I didn't make that adjustment. For PEN-HIP, is 6 months old or 16 months old? I'll have to go back and look at it. I will have to check that pen hip. And the pen hip can be done much younger, and OFA is much older. 16 weeks. Okay, 16 weeks versus 16 months. Yeah, I mean, it's going to be, I will say, most of the time when we think we see hip dysplasia, if we see a puppy walking, you know, they all kind of walk loosey-goosey, you know, a puppy's kind of, you know, but in some severe cases, we can diagnose it close to 4 to 6 months old. A lot of times the doctor will say, let's let the dog grow a little bit, because are they going to grow out of it? But in severe cases, we can diagnose it very young and be like, okay, these aren't going to get any better. So in very severe cases, I have seen it diagnosed very young. But there are times where it might look mild, and they're going to let the dog grow a little bit and see if it changes. Because as that bone gets longer, is it going to change the dynamics of the joint? We don't know. In severe cases, they will call it, oh, no, that's good. I like to clarify weeks and months and make sure we get that correct. Someone, did I answer number 30? And I've got 2 different sheets here. What are some of the risk factors for canine osteoarthritis? Explain them. The main thing we think about there is hip dysplasia. Hip dysplasia, osteoarthritis is just abnormal movement of the bone in the joint. Let me give you an example. When I was talking about the dogs that have the angular limb deformity, they put the fixator, and it's like you've got a really crooked leg, we'll go in and fracture the leg, and the doctor will adjust the bones. We're trying to get the bone to move better in the joint by changing the angle of the bone. Anytime you have abnormal movement of a bone in a joint, and the most common thing we think of is hip dysplasia, that's going to cause that osteoarthritis. But like I talked about when we did patella luxations, if you have a patella that's sliding back and forth, it's going to cause osteoarthritis because it's going to cause inflammation if we don't get that patella in the same spot. Now, again, these little dogs sometimes can live with it because they're not putting as much weight on their legs as if this was a large breed dog. But I have seen very severe, we had a really bad pug that came in with it when I was at Northwood, and we operated on both back legs at the same time because the dog basically was hopping and not putting, and the patellas were just sliding back and forth, like they were completely not. So the doctor is like, we're just gonna bite the bullet. The owner is willing to do, you know, sling walking while the leg's healed. Most of the time we'll fix one leg. They can use the other, but the dog could barely use both back legs. So he was like, we're just going to repair both at the same time. But the consequence, I would say hip dysplasia and patella luxation are the 2 common issues we see with the osteoarthritis. And I will say, an owner may not fix a patella luxation. If you've got a 14-year-old Pomeranian, especially if they've got like underlying heart disease or issues, they may decide to keep the dog and just treat them with medication, weight loss, physical therapy. So even a cruciate, if it's not causing a lot of pain, can be medically managed. And I will say, you know, since Haley brought up her own dog with the partial tear, something that hasn't been around in my era is a lot of places are getting into these braces. I've seen them on Facebook. They make braces for dogs that you can put them on. They'll actually get the measurements of your dog, and you can put this brace on. And I guess I should have mentioned to you that Haley the other day. I'd have to try to find it on Facebook or find the company. Nobody was really doing these kind of braces and making these molds for dogs in my era. But now they're doing like wow, I'm hitting like a brain blank. Like if someone loses an arm, a prosthesis. Okay. So this company is actually, you know, for amputations is trying to create prostheses and braces. So if you don't want to do surgery on your dog's stifle, you can put this brace on your dog. It has to be made to the dog because they don't make pre-prepared. I mean, every dog's length of their bones is different in anatomy, but they're starting to do this for people that maybe don't want to do surgery or the dog can't have surgery. So that's something to think about. Brianna asked about 31. Is that how does diet play a role in the development of joint disease? 31. I had 2 different homeworks here, so thank you. Okay. So what we're talking about is it will put less stress on the joints and it won't wear away the cartilage. And let me explain. When I talked about, and this is more important, I would say, in the large breed dogs, there is a reason there is puppy large breed formulas, because they will restrict some of the vitamins and minerals so that what we're trying to do is when a bone grows in a large breed dog, it grows much faster. I mean, it takes longer to grow, but it's growing at a longer rate than a small bone. If we give too many vitamins and minerals, that bone may grow faster than the muscles and the tendons attached to it. And what that can do is alter the bone's placement in the joint. So diet is the way that we're talking. It says puts less stress on the joints. If the bone grows properly with the muscle, you have less of a chance of that causing an issue in the joint because it's growing at a proper rate. Hopefully that answers the question. Again, it's, if you own a large breed dog, most people know this. We don't sell vitamins. Like I said, in my day, when I was in a clinic, they were like push vitamins. My boss was like, you almost get like a bonus if you'd sell enough vitamins to clients. So it was like, push this. And then when I got to Purdue, and one of the orthopedic surgeons, he was heading up some of this research that said, these large breed dogs shouldn't be over vitaminized. It's like we're giving them too much supplements, too much vitamins, and those bones are growing at an abnormal rate. And I know for my own dog, if you've seen enough boxers, there's 2 types. And normally the English are the shorter, compact boxer. And then you've got the American boxers, and some of these boxers come in with these really long legs. Rottweilers, I've seen this a lot in Rottweilers. A Rottweiler should be a stocky breed. And I've seen these Rottweilers that are poorly bred that come in and they're very tall and they've got these very long legs. And those dogs have OCD, which is osteochondrosis dissecans. I didn't get into OCD in this lecture, but the shoulder, a little piece of the shoulder bone will break off and float in the joint. And it's usually because their legs have grown so long that it has an abnormal movement and it can cause a fragment of that to break off in their shoulder, and they have lameness, or they have stifle issues or hip issues. So whenever you see these really leggy, tall Rottweilers, I'm like, they're not supposed to be tall. Boxers are not supposed to be tall. German Shepherds are not supposed to be. Some of these breeds need to be a little bit stockier. And that was one thing I was concerned, and I'm glad Bo is very proportionate, his legs and his body, everything's very proportionate. I didn't want him to be very leggy because I'm like, that's going to put him at a higher orthopedic risk. So sorry if that was a really long answer to a very basic question. It's one area I'm very, like I said, I worked in orthopedic surgery, so I saw a lot of this firsthand when I did soft tissue and ortho when I was at Purdue. And of course we see the worst of the worst. And even when I worked at Northwood in surgery, you see these dogs come in that are bred, and, you see this Rottweiler and I'm like, you're just a disaster. You're just an orthopedic disaster because you were just poorly bred or over vitaminized and didn't get the proper diet. So Sorry, that's my soapbox moment for the day. You guys know me. I got to have a soapbox moment maybe once a day. Come on. Did I answer? I tried to look through and see if I saw everybody's questions. I am going to post the anatomy basic review, but the big thing also is I tried to stress which bones make up what joints. Now, I talked about the hip a lot. That's the femur and the pelvis. And it's, we talked about the stifle, which is the femur and the tibia. And those, and then the patella, what its role is. So those are the main bones that make up those locations. I've been having trouble with getting images on the test, but be familiar with the pieces of the pelvis. Mostly when I talked about a hip dysplasia, the two main parts is you've got the head of the femur. I keep forgetting I got a femur right here. Okay. And then where you have the pelvis, the cup is called the acetabulum. And if you have a normal dog, the head of the femur fits very tightly into the acetabulum of the pelvis. The issue is when we don't have something called good coverage. If you've got the acetabulum out here, the femur can kind of sneak out. So we want coverage. Or sometimes the acetabulum is okay, except the hip is out here instead of being in here. So it's not always an acetabulum issue. It can be that just due to genetics, the hip is hanging out here. So, but always the big consequence, I stressed you guys, some of the things that an owner can do if they do not want to do surgery: weight management, good nutrition, glucosamine and chondroitin, non-steroidals, water therapy. In all my classes, especially as you guys get further in the program, I like to stress the nursing care and what you have to tell these owners, because you're the one talking to them. And I have to impress upon them, if you're not going to do a surgery route or surgery is not an option, what can we do to make this dog more comfortable? The one thing I did stress, the difference between a non-steroidal and the difference between glucosamine and chondroitin. First of all, non-steroidal is a pharmaceutical. It is a drug. I talked to you about the side effects that the owner has to worry about. Now, sometimes I get sedation. They're not feeling right. They're not acting right. Way too vague. They're not sedated with non-steroidals. It does not cause sedation. The things we look for are the GI signs. So we've got nausea, vomiting, diarrhea, sometimes drooling. Sometimes the dog doesn't vomit. They just go to their bowl, they smell food, and they start drooling. And that's a sign of potential stomach ulcers. That's the big thing we look for when we use these drugs. So I need to hear digestive. And sometimes people tell me, oh, the owner needs to worry about liver disease. How is an owner going to know their dog has liver inflammation at home? Liver kidney enzymes is something that we're going to monitor. Now, their dog could be nauseous. Sometimes liver disease, nauseousness, and anorexia are signs of liver disease. So if we have an elevation of liver enzymes, we're not going to continue with this medication. So I did stress that, and glucosamine and chondroitin need to be given for at least probably 4 to 6 months before they're going to see an improvement. And again, you're going to have owners that are like, I've given him 2 pills. Why is he not better? It doesn't work that way. And an owner needs to understand, if they're going to spend the money, those drugs are not cheap. Even if you get the human form at Costco, they can be pricey. Obviously, the Costco human one is cheaper than Cosequin, but I don't want them to spend that money and then realize they have to give it for 4 to 6 months. So they need to have that awareness once they start it. It's a long haul. Most of these arthritis drugs So $30 for 60. Okay. Now, when you get into these large breeds, we get into mastiffs and big dogs, they may have to take multiple pills. So 60 tablets, you know, I don't know the dose off the top of my, I'd have to look up the dose and figure how many you'd have to give. I love when people own these very large dogs and they complain about the price of medications. I didn't force you to get a 200-pound dog. Okay. Yes, it's going to cost more. You have a giant dog. Go get a Pomeranian. It's going to be cheaper. Sorry, that's another moment. I've got all this Newfs need 2 a day. And sometimes the Newfoundlands, you may go up in it. The thing with glucosamine, that's a drug that can be increased and decreased. I will say one side effect I didn't bring up, sometimes with glucosamine and chondroitin, you can get soft stools. It's not like an ulcer thing. It's not like usually a liver thing. It just can be sometimes the medication can cause a little bit of loose stools. And it may be they can't tolerate the medicine. I don't normally see an issue with glucosamine and chondroitin. Most dogs tolerate it just fine. But yeah, so if you own a big dog, everything's going to be a little more expensive because you usually have to give more of things. So that's the other thing so many people need to realize. Okay, so that was the big thing I tried in those situations. You're going to talk to a lot of people about hip dysplasia, so I want you to be very, I'm sorry that the hip dysplasia lecture did not record, but hopefully you remember what I stressed during that lecture. If you don't, feel free to email me. And